Hello, in this video we are going to talk about Alveogyl. We'll start with the composition first. It is a brown fibrous paste composed of pengavar-jambi, eugenol, sodium lauryl sulfate, calcium carbonate, mint as a flavoring agent, and excipients. Excipients are those substances which are added to the preparation so as to increase the mass and shelf life of the preparation. The intended use of Alveogyl paste in dentistry is surgical dressing of dry socket. Now let's talk about various sources and uses of the following compounds that are mentioned in the composition. First we have is the main compound itself, that is pengavar-jambi fibers. Shoria johorensis, commonly known as pengavar-jambi, it is a tree species belonging to Dipterocarpaceae family and it is native to the tropical rainforests of Southeast Asia, particularly found in Indonesia and Malaysia. Typically grows in lowland forests and can reach a height up to 30 meters. The resin obtained from this tree, pengavar-jambi, is traditionally used in Indonesian and Malaysian traditional medicine. One of its notable uses is anti-inflammatory action. It is also used in treatment of arthritis, rheumatism and muscle pain. In addition to its anti-inflammatory properties, the pengavar-jambi resin is also believed to possess antimicrobial and wound healing properties. Therefore, it is topically also applied to alleviate pain and inflammation associated with various diseases or various ailments. Now next we are going to talk about eugenol. Eugenol is a phenylpropene compound that is found in various essential oils, particularly the clove oil, which we call long in Hindi. It is used in dry socket in form of a medicated dressing or paste applied to the socket of the extracted tooth. It is an analgesic, that is a pain relieving agent, and has an antiseptic properties. These antiseptic properties of eugenol also help to alleviate pain and prevent infection in the socket. Next is sodium lauryl sulfate or SLS. SLS is a synthetic detergent that is commonly used in oral care products such as toothpaste and mouthwashes. Now it can also be used as an excipient in pastes or dressing used in dry socket because of its foaming and cleansing action. This foaming and cleansing action of SLS helps in clearing of the socket up to an extent. Additionally, it may have mild antibacterial properties contributing to the prevention of infection of dry socket. Next is calcium carbonate. Calcium carbonate is a naturally occurring mineral that is found in rocks and shells. Now use is that it acts as a protective barrier over the exposed bone of the socket, promoting healing and reducing pain associated with the condition. Additionally, calcium carbonate may also aid in neutralizing the acidic conditions that are formed by the bacterial action in the socket, which can finally lead to relief from the discomfort of the dry socket. Patients with the permanent teeth, mature or immature, are the intended population for use of the Alveogyl paste. Indications for use. Alveogyl paste is a paste that is used as dressing in case of dry socket. Next is contraindication. Contraindications are simple, that is hypersensitivity to one of the components of the preparation. These hypersensitive reactions may include skin irritation, respiratory issues, allergic dermatitis and anaphylaxis, which is rare but may occur in some conditions. Next we are going to talk about how it acts. Alveogyl is an alveolar surgical dressing which is used after tooth extractions. Alveogyl surgical dressing is applied on the site of tooth extractions with pengavar-jambi fibers, allowing compression. The paste adheres to the alveolus due to its fibrous consistency and protects extraction site with its barrier effect. It is assisted by the patient's tongue movements. It gradually self-eliminates without any intervention by the practitioner as the normal healing of the wound takes place. Before inserting the paste into the socket must be re-examined and the inside of the socket must be thoroughly curated to remove all the debris. Small pellet about 0.20 gram of paste is taken and is placed gently into the prepared dental socket. After this, the patient should be instructed not to wash their mouth vigorously within the 24 hours following the avulsion